So let's talk about hypoglycemia. What is a hypoglycemic episode? And you might hear your healthcare professional talking about a hypo, and essentially in that situation they are talking about hypoglycemia. And this is a situation where your blood sugar falls to below 4. And I like to remember that by saying 4 is the floor. And common causes of this occurring are having too much diabetes medication, so having a too high dose of the tablets that you're taking in comparison to your exercise and food, which is causing your blood sugar to fall. Doing too much exercise, for example, you've planned to do a walk for 45 minutes, but you actually end up staying up for 2 hours, and that will cause your blood sugar to fall. And also either not eating quite enough for your meal before that exercise, or before your daily activity, or having that meal late. So for example, you would normally have your meal your lunchtime meal at around 1, but on this occasion you've got caught up in something else and maybe haven't managed to sit down until 2:30 or so. So that's a problem and could cause your blood sugar to fall if you are on medication that would cause that to happen. And the sorts of symptoms that you're looking out for are feeling hot or sweaty, a bit shaky, having trouble with concentration, feeling a little confused, having poor coordination, stumbling a little bit, your speech slurring. You might also feel a little bit irritable or get some feelings of dizziness or lightheadedness and tingling in your hands and feet. And often you can almost look like you're drunk. A lot of people sort of stagger around and aren't really quite making sense. And so sometimes there have been occasions where people suffering hypos when out in public have been thought of as being drunk, and a lot of people wear a little alert bracelet so that in those sorts of situations people know that actually the problem could well be blood sugar and nothing to do with alcohol. So if your blood sugar is falling low and you are starting to sense any of these symptoms, what should you do? Well, first of all, you should always carry with you a form of quick-acting glucose. And for most people, that includes sort of 4 or 5 jelly babies, 3 or 4 dextrose tablets. They're things that can be quite easily held in your pocket or in your handbag or in the glove compartment of your car. So those are certainly things to carry with you. Also, if you're at home, certainly 200 mils of, say, fruit juice or a non-diet soda like cola or lemonade will also help to bring the sugar up, but don't overdo it. You should check your blood sugar in around 10 to 15 minutes after treating to check that it is coming up. But if it isn't coming up, you can repeat that sugary load. Once your sugar is starting to rise, you should have something to eat, a slow glycemic index releasing food. So certainly if you were about to have your meal, go ahead and have that meal. If you weren't going to have that meal, maybe follow it up with a glass of milk or a slice of wholemeal bread or something like that to just slowly release some blood sugar and keep your sugar raised. Otherwise, what you'll find is as soon as that quick-acting glucose is out of your system, your blood sugar is going to plummet back down again. If the problem has got so far that you have become unconscious or you can't really swallow, then you shouldn't be consuming anything to eat or drink, as it's possible that you should choke on it. So if you have a glucagon injection at home, you should make sure that your loved ones, your friends are aware of how to give that to you, or if they aren't able, or if you don't have that with you at home, then certainly calling 999 for an ambulance to come and treat you and get that blood sugar up is really, really important. And it's also just important to remember that after suffering a hypo, you really should not be driving for at least 45 minutes. And also, unless you've missed a meal or you over-exercise that day, if it's a medication problem, it is certainly worth talking to your doctor or your specialist nurse about your treatment, about your hypoglycemia, as they may well be able to adjust your medication or give you advice on how to avoid these, because they're really not very pleasant and can be quite dangerous, for example, if they're occurring whilst you're cycling a bike, driving a car. So diabetes and driving, as I said, on diagnosis, if you're put on medication that affects your blood glucose, you should certainly inform the DVLA. And essentially, I use the the memo 5 to drive, and that is really to say that you need to test your blood glucose before you get in your vehicle, and it needs to be above 5 for you to consider driving. And if it isn't, you need to come in, you need to eat something, wait for your sugar to come up, and then you'll be ready to do so. So obviously it's really important to have a blood glucose monitor, and if you are driving on long journeys, you certainly need to have that with you, and you need to be checking that every 2 hours or so when you're on the road. You should keep some method of sort of very quick sugar replacement in your glove compartment, and for most people that's a bag of Jelly Babies or some dextrose tablets. And it is important to remember that if you are feeling odd when you are driving, not right, feeling sweaty, like something isn't right, you certainly need to be stopping the car. And it's very important that you pull over safely and that you remove yourself from the driving seat and take the key from the ignition, to prove that you are not driving the car and that you have not been driving dangerously. The rules are very slightly different for HGV drivers, but more recently the rules have changed, whereas previously, once you were on insulin, for example, you couldn't be driving an HGV. Those rules have changed, but instead they've slightly tightened up on the monitoring rules, and you need to use a blood glucose monitor with a recording memory function to prove that you have been checking, and in the event of an accident, the police would ask you for that monitor and would assess your readings.